All right, this session is really important. Session 8 is going to be framed around Earl's latest poster. So shall we start with that?
This year's poster looks at Libby, Montana, the hard-fought community that is trying to overcome the death and environmental destruction of W.R. Grace's vermiculite mine that is brought to this community. Grace's asbestos-contaminated zonalite insulation products were shipped throughout the country. While the mine stopped operation in the 1990s, that asbestos continues to harm and kill miners, their family, and community members who are exposed in public buildings and at their homes.
So every one of Earl's posters, we spend a lot of time going through the thought process. What kind of research can we do in the field that goes with the posters, as the chlor-alkali one, number 7. But this one was particularly important to us. And if you notice, I want you to take a look at the center map, which has the dots that show where the zonalite was transported to. You can see the larger circle, so you can see the burden of exposure. And the images in this poster were taken before the verdict of the W.R. Grace case, which was terrible, against the card clinic. So let's get started. We are going straight to Dr. Brad Black by way of remote. Brad, why don't you introduce yourself briefly and let's get started.
Well, I'm sorry I couldn't be at the session. I'm still isolated up here in far reaches of northwest Montana. There are a few people that made it here. Linda, Earl daughter, made it up this year, and they thought they know what it's like to get to Libby, Montana. And of course, then I turned around and took them way up into the hills. We had to get pictures, so you'll see some of that on Earl's production. But anyway, I would like to start up here with the slides, and I titled the article "Libby Ample Asbestos: Will the Libby, Montana Experience Be Forgotten?" And these have been concerns for a while, and I know Linda's voiced those a bit too, as far as who's going to keep things going, right, going forward. And this is really an important area when it relates to Libby ample asbestos. We've got this isolated community, which once again Lynn and Earl found, but in a way we're out of sight and out of mind. We have been for years, and that's a great reason why what happened there happened. Unfortunately, now the same holds for the Libby ample asbestos. Now that we didn't recognize it for years, and now that we do, we find that very few people know about it, even after all the work we've done and worked with our collaborators at Mount Sinai and University of Cincinnati and other institutions. Anyway, after more than 22 years of experience, a lot has been learned, and we've published a fair amount in the literature on the Libby amphibole. So our experience at CARD relating to screening shows that we have screened over 10,000 of current or former residents at the CARD clinic. Now keep in mind, this number is it's less than 15% of those that were exposed over the life of the vermiculite mine. So we've just got a smaller piece of that exposed population. Many of them had left the community, and who knows, we don't know what happened to folks that lived here. We do know there's probably a large amount of disease that has been missed, very likely for those people that moved away from the community and maybe developed symptoms but were not recognized. So, next slide. You look at the mortality, the last look by NIOSH showed the asbestosis mortality by county, putting Lincoln County, Montana at the top of the list. And that was 2009, and most likely we've maintained that based on the current death rate each year from asbestos-related disease. Next slide. The HSDR did mortality studies when the revelation of the problem in Libya was made in November 1999, and it showed a very high asbestosis mortality rate, even in those years, 40 to 80 times higher than the U.S. rate. And of course, lung cancer rate was elevated. Increased rates of mesothelioma, though they didn't have a lot of data at the time. I can tell you we've had 45 mesotheliomas since I've been at the card clinic. Libya, we know how bad it's been in Libya, but indicators are from export sites, the ones that you were looking at, there are all the dots on the map. The Minneapolis-St. Paul processing facility for Libya vermiculite was also, there was a cohort that was studied that lived in close proximity to that processing plant, and the Minnesota Department of Health followed them. And the latest publication they had was 2014, describing the increased respiratory disease, lung cancer, and mesotheliomas within that cohort that involved those, and I forget the exact radius around the processing facility, but anyway, it was in closer proximity. It just tells you this is the tip of an iceberg. We don't have data from a lot of sites. We do have some from Marysville, Ohio, which was another site where the material, Libya ore was expanded by the Scots Company. The next slide then. So in addition to this is more information on the Minneapolis-St. Paul site. You'll see on the left, of course, there's a picture of describing the workers that worked at the processing plant in Minneapolis-St. Paul. And 11 of the 28 workers were reported to have died as a result of the Libya amphibole exposure. And if you the classic slide on this slide on the right, the two young men, two young boys playing in the Libya vermiculite ore waste there at the Minneapolis site. One of those boys died of lung cancer at age 44. Tissue studies done by, I think, Dr. Rogley, and published, demonstrated the presence of Libya amphibole disease. At that time, it was called tremolite, but we've since realized it's a little bit different than that. So next slide. And we did do a card mortality study. As a matter of fact, Dr. Frank was involved with this also and did a lot of the groundwork on it along with Dr. Whitehouse, and then we published this. And it describes mortality within our clinic population for the years 2000 to 2010. Over half of the deaths in our clinic population were related to asbestos-related disease based on death certificates and using the best clinical and radiographic evidence to assess causation. And overall, we had, at the beginning of CARD in 2001, there had already been an estimated 300 deaths related to asbestos exposure in Libya. And since 2001 until 2021, we're now approaching another 300 deaths related to Libya amphibole, totaling about 600 deaths at the site that we're aware of. It doesn't nearly reflect probably the mortality, I'm sure, we don't want to know, probably based on what we've learned just by what has been present in Libya. So next slide. How did the ongoing exposure and asbestos-related disease go undetected for so many years? And I know that's asked a lot, it continues to get asked, but two of the guys that I have greatly respected, one being an investigative reporter who knew more about public health than most of us in public health did, and Alan Whitehouse, of course, pulmonologist in Spokane, who recognized problems with the Libya population that was very different than what he was seeing in his other cohort of patients from Hanford that were exposed to commercial fibers, Chrystal mostly. So Anyway, thanks to him, I mean, this disease would have gone probably undiscovered for the most part. When we look at this, more than 30 years after Grace was aware of workers becoming ill, and nearly 20 years after the EPA was aware and concerned of the hazards of the contaminated Libby ore product, there came Andy Snyder, who got in there and went to work and did a remarkable piece of work exposing the situation in Libby. But it's just a few things that grabbed this whole thing in Libby to bring awareness. And now, after this many years, we have a lot better understanding. And the key thing that Dr. Whitehouse brought out was that he validated the presence of serious disease not only in mine workers but in community workers as well. So this is what really drove the agencies to go to work. Once his cases were validated, it was known that there was it could be a very broad problem within the community. The next slide. So further, how was it overlooked? Well, we all know that the deception was high. The conniving that went on was now quite well exposed based on the behaviors of W.R. Grace and the railroad, BNSF, having known the risks to the workers, but never disclosed any of this to our community. The other issues with this is the low-level exposures. This was elucidated by Dr. Jim Locke at the University of Cincinnati. They were asked to evaluate a Scott's company processing plant there in Marysville, Ohio, and they were able to follow workers that were exposed to Libby amphibole in low doses, and they were surprised to find out that much less exposure triggered pleural disease in that population. So that went against all our understanding of asbestos, where you had to work in heavy dust to really develop disease. And of course, the very pattern of fibrosis was it's something that doesn't stand out and catch your eye. We don't see plaques to the number. We see plaques, of course, but not typically. The workers, a lot of them have this thin progressive scarring of the pleura, which is subtle on x-ray until it advances, until they get severe disease. So this disease can go undiagnosed for years. I want to show you, well, first of all, due to lack of experience, next slide, due to lack of experience with Libby amphibole disease, many clinicians, radiologists don't recognize structural changes from the Libby amphibole disease until it becomes advanced enough or it becomes obvious to most people. Next slide. So here's an example. You're not going to be able to interpret this film. This is a CT slice from a former Libby mine worker. You worked there 20 years, had extremely high exposure, very symptomatic, had a lot of chest pain, shortness of breath, and he was diagnosed in 1989 by Dr. Whitehouse. He was not recognized by a radiologist to have any abnormalities until 2014. I mean, we're talking, what, 24, 25 years. He would have gone undiagnosed if you didn't know what you were looking for. In 2014, he had a small spot on his lung. And we biopsied it, and it was a early lung cancer. And so during that time when the cancer was removed by thoracoscopy, there was direct visualization and picture taken inside the chest, and tissue analysis clearly showed asbestosis and pleural fibrosis, along with a lot of asbestos bodies, et cetera. Now, the next slide shows, it's just a picture. I don't have anything to point to, but on the right side of the picture, you'll see a sheet of white along that. That's the chest wall, and that's that thin layering that we see. It doesn't sit out like a plaque. It's just a thin scarring along the lining, just like a sheet. And so next slide. So who shows up? You know, this is Dr. Steve Levin was of course, at Mount Sinai, worked at the Selikoff Center, and became interested in understanding what Dr. Whitehouse had observed. And we invited him to Libby. He came and spent a number of days reviewing charts and cases at CARD. He had access to everything he wanted. And that's when his expression came out, this Libby disease is not your grandfather's asbestosis.
Dr.
So Steve,
Black, we're going to have to move the last slides a little quickly, if you could help us.
Okay, all right, thank you. Anyway, he dedicated time to work with Libby. Now, let me further talk about the fact that Libby's disease stays under the radar. There's no standards for radiologic detection. There's less than satisfactory agreement among radiologists. And so through kappa analysis, which is a method to decide how much readers can agree, that's just an real quick description. We followed our reads from our clinic, and this is looking for asbestosis. There's fairly good agreement. It's the CT on the right is the graph on the right that shows that. But when it comes to plural, it's just there's only moderate agreement. So it never gets better over the years. This goes over 3 or 4 years. There's in peer review sections, it never gets better. So anyway, understanding the clinical disease and patterns along with radiologic imaging is so important. So I think it's important that people realize, and I'll move to this next one. We'll get through this. It's important to educate now. Awareness on exposure risks to Libby amphibole as well as other asbestos, of course, too, is vitally important across the U.S. It must be directed at the general population because of the contaminated product being present around the country, multiple homes and businesses. People must understand that the workers, the general public, must be aware of asbestos hazards and the risk, and seek medical providers knowledgeable in asbestos exposure and have experience in the clinical recognition of asbestos-related disease. So that ends my talk, but I just want to end it by saying, look, it's very concerning. We missed it for years, and once we learned about it, now it's hard to get this type of information around the country. So I take this opportunity to do that, and I appreciate the time. And of course, Lynn has worked hard to keep Libby amphibole in the front of regulation also, which is the recognition as an asbestos character. So anyway, thank you very much.